I'm Dr. Michael Lowers. I'm the Associate Medical Director at Reset Medical and Wellness, which is a new medical center in Strongsville. And what we do is offer mental health care for patients with anxiety disorders and PTSD primarily. So my background is in interventional pain management. So I was doing that for a number of years, about 15 years prior to this. And I just, frankly, I got kind of tired of poor patient care, and I felt that I could do better. So in looking at new opportunities, a colleague of mine, Dr. Josh Goldner, talked to me about this center that he and Kelly Price were starting, and gave me the information. I looked into it. I thought it was really compelling, but most importantly, it would give me the opportunity to really spend the time, the quality time that I thought the patients deserved, while providing really great healthcare in sort of my field, but also opening a new window of opportunity treating mental health.
Hi, I'm Nicole Harwood. I'm the Director of Patient Engagement and a partner with the Reset Medical and Wellness Center in Strongsville. So my responsibility, a few things, but primarily to ensure that from the time a lead or patient calls us to know more about what we treat and how we do that, all the way to up to 2+ years after they've been treated, to understand how they're feeling, their symptoms, how they've improved, and so on. So really ensuring that the care that we're providing is more in an addition to in the office, but also all of the intake from the very beginning, and then the care post-care after the treatment.
So we offer a very unique treatment. We have comprehensive treatments that we do. We offer ketamine therapy, we offer myofascial treatment, but our takeaway, what really makes us different, is a modified type of nerve block that we do to treat a number of conditions, specifically anxiety disorders. And this isn't something that is offered in most places. It's not that the treatment is new. The treatment's been around for 100 years, but the actual utilization of it for mental health is sort of groundbreaking. And so that kind of sets us apart, because there's not a lot of places, certainly in Northeast Ohio, but really even around the country, that offer this specifically for mental health care. And it's gained a lot of traction, and it has really promising benefits, and we've seen excellent results.
There's so many parts of this space and time and career that I love, and the probably one of the most is that the relief that our patients realize is very quick. And a lot of times, work that I've done throughout my career, it takes a little while to see the fruits of your labor and to really see people, whether it's developing in leadership roles, it's learning new things, and in this case, seeing our patients get well quickly. And I've talked with Dr. Lowers about that as well. Is in that field, you get a chance to hear pretty quickly. I mean, a lot of times folks feel the relief while they're on the table, right after the injections, and sometimes a week or two later. But just knowing that we've been able to impact someone's life, not just that person, but their families, their children. We had a chance to interview a patient who we treated, and we actually met with his young children and his wife, and his kids were saying how grateful they were that their dad had this treatment, because it's improving all of their lives, and they get to do things and interact with their dad in a way that they had missed getting to do from him having some significant trauma.
So in order to understand how it works, you have to understand a little bit about anxiety disorders. So typically, you have a part of your nervous system that responds to stressful events. right? So if you're in the woods and you hear growling, what's going to happen? Your heart rate gets going, you're breathing faster, your adrenaline's pumping. That's a normal, healthy response. You want that. But in folks that have been traumatized, that have had multiple stressful events or recurrent anxiety-provoking events like that, that part of our nervous system becomes overactive, becomes hyperactive. And it begins to respond to even benign triggers. So that just the memory of an event or seeing something familiar that reminds you of an event that occurred in the past, or benign stressors like just thinking about what you have to do the next day triggers the same physiologic reaction. And we call it our fight or flight response. But what happens then, you can imagine if your heart rate's going, your adrenaline's pumping, you're going to have trouble falling asleep. You're going to have trouble with social interactions. And that alone will trigger anxiety, but also a number of physical ailments from that going on all the time. And there's a number of ways to treat that. We can, certainly use counseling and medications, and those traditional forms of therapy are often effective, but in those that it's not effective, this is an alternative treatment, often one that complements those other treatments. And what we do is a specific type of nerve block. It's a block done in the neck at sort of what you might consider the fuse box for that part of our nervous system, for our fight or flight system. And by blocking that part of our nervous system, even temporarily, it brings that response, that hypervigilance, that fight or flight response back down to a baseline. And that allows us to then address these triggers, and it can last months to years even though the anesthetic wears off. And that will then allow these patients to move forward with their lives, to start to address these triggers, to gain more out of counseling and mindfulness, and then in essence treat their anxiety disorders, often very successfully.
When I think about why I love doing this, my background was not in this area, and so when I had an opportunity to do something very different, but directly, again, working with people and helping to improve their lives. And so one of my favorite things that I get to do is to hear people's story, what they're experiencing, and then how much different their lives are after having the treatment and the people that it impacts. I think that's, and knowing that this is not just one person, it's several people, and it can change an entire family, community, and such. So I'm really grateful for the patients that we have and for our team. We've had patients say, we wish that it took more than 2 appointments because we love coming to your center and it's so warm and welcoming. And so we begin to build a relationship with folks, and that's where a lot of times people are telling others about it and they're coming back through to see us. So we're very thankful for that.
Main patient type that we see is going to be folks with PTSD. Historically, that was thought to be mostly veterans, military, first responders perhaps, but really that has spilled over much more into the civilian population, and that makes sense because PTSD doesn't have to be some horrific military trauma that you underwent. Certainly it can be and often is, but it may be something much more simple, something like family struggles, divorce, losing a job, financial struggles, all those things which are, on everyone's plate is potentially going to cause PTSD or some form of anxiety. And in addition to that, the treatment we find can help a number of other conditions that may be secondary to that. Like I said, this can affect anything mind and body related. So folks often have difficulty sleeping and insomnia. They have depression, they have low productivity and their energy is down, chronic fatigue. And so those conditions they may not recognize as anxiety disorders or PTSD, but they know these symptoms. And so getting the word to those folks that this might be a helpful treatment, I think, is equally as important. SAR can help with a number of conditions, certainly anxiety and PTSD, but also depression is high on the list, insomnia, as I mentioned, and there's a lot of secondary gain from other conditions that are related to these primary things. So chronic fatigue, and we see that with patients with long COVID, as an example. It can also help certain types of symptoms from menopause. So things like hot flashes can be helped, brain fog. Those symptoms, perimenopausal symptoms, are often one of the main treatments that we see. And then even other conditions like chronic headaches and eating disorders, often related to stress and anxiety, are treated.
To learn more and just to get started, go to our website, theresetcenter.com. You can fill out, there's a place to fill out a free mental health assessment that'll come straight to us. We'll get in touch and walk our patients through the process and really help them get on board and understand. There's other information on our website, including testimonials like the gentleman I just spoke of who was treated and his family. So we try to make it very informative. Our doctor has a recorded webinar that's there so people can get more information about what this is, what we treat, and how people can get better.